So Brittany, what whitening options do we offer here at Spodak?
Well, we offer KoR Whitening. I want to talk a little bit about in-office versus over-the-counter whitening. There are different kind of results that you get from both, and I get asked this question a lot. Over the counter, the best option is like a whitening strip because it's non-abrasive. It's definitely not as strong as what we would use in office. It's like prescription versus over the counter, anything else, any other medication. So a lot of people find that they don't get the results that they want just from using over-the-counter products like a Crest whitening strip.
Right.
If someone is looking for an inexpensive option and they just need a small change, that's what I would recommend, something over-the-counter with just strips. If we're talking in office and someone wants a more significant change, which is what most people are looking for when we're talking about whitening,
yep.
We offer KoR Whitening. KoR Whitening is currently the best in-office whitening system that is offered on the market. It's a prescription strength whitening system. We do in-office and at-home treatments with this. Depending on the patient's needs and what they're looking for is how we kind of choose, and we have a discussion with the patient to decide what's best for them depending on their wants and needs. One thing that I want to say about KoR Whitening is that it's the only whitening system that guarantees a specific result.
Okay.
It's also the only whitening system used by dental offices that is refrigerated from start to finish. So from when they produce it, when it is shipped, and at the office, it stays refrigerated so that it is not activated before we start to use it on the patient.
I always see every time they deliver it, it's like the box with the smoke coming
Exactly.
out. So cold.
Exactly. Yeah, that dry ice. Exactly. Probably is what it is dry ice. So we keep it refrigerated here until we're using it. My favorite system to use on most patients is the KoR in-office and the KoR nighttime. KoR in-office is called KoR Max, and the KoR that's used at nighttime is called KoR Nighttime. The combination of both of those things is the most effective thing that a patient can do.
So it's a combo?
It's a combo,
okay.
Yeah. So the benefit is that when we do an in-office whitening treatment, teeth always revert back to their original shade and sometimes darker because we restain with dark liquids, even things that people don't think about like blueberries, anything that can turn your tongue or the inside of your mouth a different color can discolor your teeth.
Well.
It's
so funny because people only think, it's only going to be like coffee, or cigarettes.
Red wine, cigarettes, yeah, exactly.
Fruits
exactly.
can stain your teeth.
Anything that has that deep, rich color can stain your teeth over again. So in-office whitening, very, very effective. We do take pre and post whitening shade photos so that we could see the difference same day when we do that. It's about a 90-minute appointment if we're doing an in-office treatment. The beginning is the pre-shade photos, like I just mentioned. We do a pre-whitening desensitizer. A lot of people have questions about that.
Okay, so that's applied before getting the whitening so you don't feel...
It is. So you don't have that temporary sensitivity that sometimes comes along with any sort of whitening, whether it's over-the-counter or in-office. What causes the sensitivity is just pores opening in our teeth and then closing back down over time. So while the pores are open for a couple days after the whitening, teeth can feel more sensitive, and it just has to do with the little tubules inside our teeth that lead from the outside in the oral environment to the inside where the nerve of the tooth is. As the pores close, we feel a lot less. The sensitivity that comes after whitening is always transient. It does always go away, but the intensity that can come from in-office or at-home whitening can be very, very intense for some patients who are prone to having that sensitivity, and less intense to patients who generally have less tooth sensitivity. So the pre-whitening desensitizer that we use, I dry the teeth thoroughly, put on 3 applications of this desensitizer, and it basically just protects the pores, but it still enables the whitening process to commence as needed, and it's very, very effective still. For my really hypersensitive patients, this desensitizer has worked like amazingly. With different systems that I've used, this has been the best desensitizer, and it's interesting because this is also the strongest whitening product that we've ever had.
Right.
So the desensitizer is very, very effective in preventing that severe post-operative sensitivity.
Nice.
So that's used before any in-office KoR is done. So the way that works is if you're doing in-office KoR whitening, it's 3 applications of carbamide peroxide. It's 34%. Each application, I mix the whitening gel right before applying it to the teeth, and that's what activates it. Each application is about 20 minutes long. So 3 applications of 20 minutes where I mix the product right before I apply it to the teeth. Afterwards, I suction in between each application. Afterwards, suction it off, remove gingival barriers and the things that are set in place beforehand to protect the gums from the whitening gel.
Right.
Then we take the post-operative photo and we kind of see how far we've come.
Okay.
The reason that I recommend doing an in-office and an at-home system is because, like I mentioned before, your teeth will always revert back to a darker shade depending on your diet and what, if you drink coffee, red wine, and dark liquids frequently like I do. So the at-home whitening trays allow you to kind of touch up as needed after an in-office treatment.
Okay.
If a person doesn't need significant change or isn't wanting a significant change in the shade of their teeth, they can just do at-home trays. They can skip the in-office whitening and just do at-home trays. That is about 2 weeks of whitening every single night, overnight, with the desensitizer that they would use at home.
Right.
And that can be very effective too. It just depends on kind of like subjectively what the patient wants. Opalescence can be used in retainers, or if you have whitening trays that you used previously, you can use the opalescence gel. Opalescence isn't as effective. It doesn't have the guarantee that KoR does. Also, the whitening trays made with opalescence do not have like a little reservoir on the front side of each tooth to hold the whitening gel, so a lot of that gel tends to gush out.
Goes up to the gums and outside. Okay,
exactly. So the opalescence isn't my favorite because it's a little less effective in my opinion and what I've seen clinically, but it still works for some people and some people really like it. So again, it just depends on kind of what you're looking for, what you already have, what you've done in the past, and what you need right now.
Awesome. And then a lot of patients ask is, does it work if I've had previous dental work, meaning crowns or veneers?
So this is a question that I'm asked very frequently, and it's a common concern because a lot of people do have crowns in the front side, in the front teeth, areas that are visible if you whiten. Anything that has been done by a dentist, a crown, a veneer, a filling, is not going to change in color when you whiten. So those are the things to take into consideration. If you have any of those things in the front teeth and they match the current shade of your teeth, when you whiten, those crowns and veneers or whatever synthetic materials in your mouth is not going to change in color, but the surrounding teeth will. So you may see a difference. There may be a discrepancy in the color between the synthetic part in your natural tooth.
Okay.
So it's something to discuss with your hygienist or your doctor if you have concerns about that, and something that they will bring up if they see those things present in your mouth and that is a concern for you. Or if we're doing restorative work in the front teeth, yes, we'll bring up, do you want to whiten ahead of time? And this is why, because after we choose the shade, we can't change the shade again of that synthetic material. We have to do it beforehand. So ideally, if you need front teeth dental work, ask your doctor, ask your hygienist. They're probably going to bring it up to you whether or not you want to whiten. And my advice is whiten beforehand, get to the shade that you want to, let the teeth kind of rest for about 2 weeks and settle into the proper shade and make sure that you're happy with it, and then have the dental work done.
All right. Sounds good.
Okay.
Alrighty, perfect. So there you guys have it. If you guys have any other further questions or concerns about our in-house whitening or out-of-office whitening and what we offer to whiten your teeth, please comment below and Brittany will be more than happy to go ahead and answer it for you. In the meantime, thank you, Brittany, so much and have a great day.
Yeah, you too.
Bye, guys.